Good morning, sir. My name is Jean Alan Francisco Maligsa. I'll be your student nurse for today from Wesleyan University, Philippines. Before we start, I would like to perform a hand hygiene to prevent microorganisms. Okay. Before we begin, I would like to ask some questions to get some details about yourself. Okay. What is your full name, sir?
Julius Kunanan,
Jules Kunan. And where do you live, sir?
Palasinan, Cabio, Nueva Ecija.
Parasinan, Cabio de Francia. And how old are you, sir?
25.
And your occupation, sir?
Event organizer.
Events organizer. Okay. Let us move on now to source and reliability. Who's with you today, sir?
Family ko po.
Your family. Okay.
Yes.
And now for the reason for seeking care, why are you here, sir?
I have a fever.
Okay, you have a fever. Do you have any history or present history illnesses?
Wala, nothing.
Nothing. Okay. Okay. Let us move on now for the health history. Do you have any heart disease?
Nothing.
How about allergies?
Nothing.
High blood pressures?
Pardon?
Do you have high blood pressure?
Sometimes.
Sometimes. How about an asthma?
Sometimes.
Do you have history of stroke? None.
I don't think so.
None. How about obesity? Are you obese? None.
No.
No. Do you have any history of diabetes?
No.
Okay. How about, do you have any blood disorder? Mental illnesses? Okay. Do you have any history of seizure disorder?
No. None.
Okay. How about kidney disease? Okay. Let us move on now for the review of the system. I will go and check your general overall healthcare status now. So, weight gain for the past 3 months. Are you gaining weight for the past 3 months?
A little bit.
A little bit, okay. How about a fatigue? None. Weakness of malayas? None. Okay. You have fever? You just told me, okay. How about chills and night sweats? Pinapapawisan? None?
Sometimes.
Sometimes, okay. For your skin, do you have any history of skin disease?
No.
None. Pigment of color changes, change in mole? None.
No.
How about excessive dryness in skin?
No.
No. Okay. How about rashes?
No.
None. Okay. For your hair, do you experience hair loss?
No.
None. Change in texture in the hair? None. Okay. And then for the nails, change shape?
None.
None. Change in color of the nails?
None.
Okay. How about your head, sir? Frequent or severe headache? Do you experience that?
Sometimes.
Sometimes, okay. History, do you have any history of head injuries? Okay. Have you been experiencing dizziness, vertigo?
Sometimes.
Sometimes, okay. For your eye, do you have any difficulty with your visions?
None.
None. Eye pain?
None.
None. How about double visions?
None.
None. Redness of eyes or swelling? None. How about watering or discharge? None. Okay. Do you wear sunglasses or contact lens?
None.
None. Okay. Let's move on for your ear. Do you have ear aches? Any infections?
None.
Discharges,
None.
ringing of ears,
None.
vertigo,
None.
hearing losses, use of hearing aid, none. Okay. For your sinuses, let's check your nose. Any discharges, severe colds. How about sinus pain?
Sometimes.
Sometimes, okay. Have you been experiencing nose bleeding?
None.
Change in sense of smell?
None.
Okay. How about allergy?
None.
None, okay. For your throat and mouth, I wanted to know if you were gaining pain in your mouth.
None.
Frequent sore throat.
Sometimes.
Okay, sometimes. How about bleeding gums?
None.
Toothache.
None.
Okay. Lesion in mouth or tongue?
None.
None. Have you been experiencing difficulty in swallowing?
None.
None. Okay. Have you been experiencing altered taste?
Sometimes.
Sometimes, okay. Do you go to dental cares?
Every month.
Every month, okay. For the past, do you have a history of dental braces?
Before.
Okay. When was your last checkup?
Last 3 months.
Last 3 months, okay. Let us move on for your neck. Any pain in your neck?
None.
Limitation of motion, stiff neck, like something like that? None. Lump or swelling?
None.
None. How about enlarged tender of nodes? None. Okay. Do you have any goiter?
None.
No. What will be, Okay, I will check your respiratory system now. Do you have any history of lung disease? No. Chest pain?
None.
Problem of breathing?
Sometimes.
Sometimes, okay. Do you have shortness of breath?
Sometimes.
Sometimes. Do you have cough?
Sometimes.
Okay. Are you exposed to toxin or pollution that may irritate your...
Sometimes.
Okay, sometimes. Do you have any history of x-rays? Chest x-rays?
Yes.
Okay. When was your last x-rays?
That is 3 months ago.
3 months ago, okay. For your cardiovascular system, I know if there is any chest pain? No. How about palpitation? None. Okay. Dyspnea? None. Okay. How about hypertension?
Sometimes.
Sometimes. Anemia?
None.
No. Okay. Okay, let us move on for the peripheral vascular system. Coldness, numbness, and tingling swelling of legs?
None.
None. Discoloration of hand and feet?
None.
Okay. Okay. Do you have varicose veins?
A little bit.
Okay, you have. Have you been experiencing pain on your legs when you're walking and exercising relieved by the rest?
None.
No, okay. History of thrombophlebotitis? None. Ulcers?
None.
None, okay. Let us move on for the gastrointestinal system. Loss of appetite to eat?
Sometimes.
Sometimes. Food intolerance. Do you have any irritation of food? None. Okay. How about heartburns?
Sometimes.
Okay. Indigestion?
None.
Pain associated with eating?
None.
Any pain? None. Abdominal pain. Do you have that? Nausea or vomiting? Do you have that? Okay. Do you have a history of abdominal disease before? None. Okay. Constipation?
None.
Experiencing diarrhea?
None.
Okay. Rectal bleeding?
None.
Okay. For your urinary system, I would like to know, Have you been experiencing urgency for your ano? None. Nocturia. Do you experience that? Okay. Dysuria.
None.
Polaria.
None.
Algeria.
None.
None. Okay. How about hesitancy or straining? Okay. I would like to know, in your male genital system, does your penis or testicle are in pain sometimes?
None.
Sore in lesions? None. Okay. Do you have penile discharges?
None.
Lungs, hernia? None? Okay. Let us move on for the musical system. History of arthritis, do you have that? History of gout?
None.
Pain?
None.
Stiffness or swelling of joints? None. Joints deformity?
None.
Limitation of motion in joints?
None.
Okay. How about muscle pains?
Sometimes.
Sometimes. Do you experience weakness also? Weakness in muscle?
Sometimes.
Sometimes. Problem in walking?
Sometimes.
Sometimes. Okay. How about back pain? Stiffness and limitation of motion muscle in the back?
Sometimes.
Sometimes. History of this disease? Do you have any history of disease in the bones? None. Do you perform exercise? Walking, aerobic, dancing, anything? Okay. Let's see. Are you having or struggling in performing ALD activities, daily living, grooming, or doing chores? No. Okay. For your neurologic system, I would like to know if there is any history of seizure disorder? None. History of stroke? None. History of fainting? Blackout? Okay. Weakness in any body part? None. Thick or tremor? None. Paralysis? Okay. Coordination problem?
None.
Memory disorder?
None.
None. Okay. Let us now move on to hematologic system. Bleeding tendency of skin or mucous membrane? Okay. Excessive bruising?
None.
Okay. Lymph node swelling? Exposure to toxic agent or radiation? Do you have that?
None.
None. How about blood transfusion?
None.
None. Okay. Let's move on for the endocrine system. History of diabetes?
None.
None. Excessive urination? Do you have that? Okay. Excessive thirst?
None.
Okay. How about hunger? Excessive hunger?
None.
History of thyroid?
None.
Intolerance to heat and cold?
None.
Okay. Have you been experiencing changes in your skin pigmentation or texture?
None.
Excessive sweating?
None.
You were gaining weight. Am I right?
Yes.
Okay. Do you experience nervousness
Sometimes.
in a daily basis?
No.
No. How about tremor? Enlarge of neck? Having goiter? None? Okay. Let us move on for your sexual health. Are you presently in a relationship involving intercourse or sex?
Yes.
Yes, okay. Any painful sexual intercourse?
None.
None, okay. How about the problem in erection or ejaculation?
None.
None, okay. History of transmitted disease? No? Do you have HIV? None, okay. For the other stalker behavior, conflict state manuscript. Describe your stress in life now. Describe your stresses. What do you stress most?
Financial problem.
Financial. Okay. You've been thinking a lot. That's why you were stressed. Overthinking. Am I right? Okay. Do you have any changes in your physical ways in the past?
None.
Okay. Do you have any methods on how to relieve those kind of stress? Like stress eating? Smoking?
Sometimes.
Do you do alcohol or cigarettes?
Sometimes.
Yeah, okay. Are these methods help you?
None.
None. Why is that?
I don't think so.
Because you came here because you were struggling having a problem in your situation right now.
Yeah.
Okay. Uh, how about personal habits? Do you daily intake a caffeine, coffee, tea, colas, something like that? No, okay.
Sometimes.
Sometimes, okay. You said you were smoking a cigarette, right? Daily use how many years? How many?
Long.
Yes.
Almost
How long do you
more
usually?
than more than 2 years.
More than 2 years. Do you ever try to quit?
Um, Last month I quit smoking.
Okay, you just quit last month. Do you ever drink alcohol?
Do I never drink?
Do you drink alcohol?
Sometimes, occasionally.
Occasionally. Okay. How much alcohol did you drink? How much amount of that alcohol do you drink?
Um,
A little bit.
1 to 2 glass of.
1 to 2 glass, okay. Okay, occasionally. Do you have any problem in drinking? None. Okay. Ever had use of drugs? Do you do that? None. Okay. In what age do you started drinking or doing these kinds of habit? Drinking, smoking. At what age?
When I was 21.
Okay. Uh, do you have any number of packs per day of you on how do you use cigarette? Number of packs? You only smoke once a day, something like that before?
Sometimes half cake,
Half the half
pack.
half pack of the cigarette. Okay. Okay. Have you been using marijuana, cocaine?
Never.
Okay. LSD, heroin, other stuff of drugs? Okay, no. Okay, no. So that would be all, ma'am. Sir, that will be all, sir. Thank you for your participation. Okay. Okay na.